Hello, this is Dr. Michael Shear with Learn LODI, a free resource on how to market, treatment plan, place, and maintain LOCATOR overdenture implants. Today's YouTube video is going to be describing this exciting journal article release that just recently came out in the Journal of Implant and Reconstructive Dentistry. This article I published in this journal so that way it is a clinical guideline for most clinicians out there to help bring in some of the factors that are involved with treatment planning as well as treating patients with either a standard or a narrow diameter implant for the purposes of implant overdenture therapy. I'm going to go ahead and go through most of the features of this article, and this article is available from either Biomet 3i as well as Zest Anchors, or on the Journal of Implant and Reconstructive Dentistry website. Inside of this article is a comprehensive review as well as a prospective type analysis of when clinicians should be making decisions about when to place a standard diameter implant for the purposes of an implant overdenture or a narrow diameter implant for the purposes of an overdenture. So I also have in front of you a multitude of different information as well as models to describe some of the features and things that I have talked about in this article. First and foremost, what we're going to do is talk about the differences between what we do on the maxilla versus the mandible. Typically, in the mandible, we place somewhere between 2 and 4 implants, and it's usually localized somewhere in the anterior mandible. And I went ahead and I gave this little pictorial demonstration of what a patient's mandibular arch would look like in a panoramic radiograph. And typically, we would be placing somewhere between 2 and 4 implants in the anterior mandible corresponding to these positions, typically referred to as the A, B, D, or E positions, and some people commonly refer to them as the 1, 2, 3, 4, or 5 positions, depending upon where your training is. Also, the principal reason why we typically will designate some of the areas in the anterior mandibles is most of our patients that are seeking out overdenture therapy typically have heavy resorption in the posterior mandible, precluding the ability of using a either standard or narrow diameter implant in the posterior mandible due to heavy amounts of resorption. Where typically in the anterior mandible, we almost always have adequate bone in terms of at least bone height, and also in regards to the safety of the anatomical structures. But many times what's a limiting factor is our bone width. Hence the indication for narrow diameter implants in situations especially obvious with narrow ridge widths. On the maxillary arch, we're typically placing somewhere between 4 and 6 implants. Now on the maxillary arch, the general consensus is the more implants the better because of low bone density as well as all of the clinical studies that indicate that typically when we try to have 4 implants as a minimum on the maxillary arch, we get the best results. And many times our patients are being motivated by the fact that they would like to get rid of the palate. Anytime that the patient in my practice wants to get rid of a palate on a maxillary restoration, denture, etc., I always recommend a minimum of 4 implants. And there's a multitude of reasons for that, but it has to do with the amount of stability, cross-arch stability, as well as forces being displaced on those implants. I like to go ahead and say recommend somewhere between 4 and 6 because many times on the maxillary arch, because of low bone density, occasionally we might lose 1 or possibly 2 implants. When we have 6 being placed, if we do lose 1, then we still have more than enough to have a palateless denture. But if you stick to 4 and you do lose 1, that makes your treatment planning very complicated. So first and foremost, when we start looking at some of the indications and the differences between a narrow diameter and a standard diameter implant, it's pretty obvious to see. A standard diameter implant is typically anything above 3.0 millimeters, and this is just showing you an example of a Zimmer-Biomet standard platform implant, happens to be a 3.25, 3.4 osteotype implant. Right in front of you here, however, is a 2.4 by 12 millimeter Zest Anchors LODI or LOCATOR overdenture implant, and that's showing you the characteristics of the differences between the two. You can also flip to in the JERD article when you start looking at some of those characteristics. It really helps to break those down into 2, and like I said here, typically it's greater than 3 or for narrow diameter less than 3. With standard diameter implants, there's also typically greater surface area, and with narrow diameter implants, there's less. The varying thread design just depends upon the different implant companies, where typically narrow diameter implants have a much more aggressive thread design. And then also typically the standard diameter implant is a two-piece, where a narrow diameter implant can be one or two pieces. Some definitive factors between standard and narrow diameter implants is most narrow diameter implants use an unsubmerged healing and also an external connection. Because of the size of the implant, when you drop below 3 millimeters, it's very difficult to have an internal connection, which is what you see right over in here with this standard certain type of connection for the OsseoTite implant. As you look over in here, we can do that with a standard diameter implant, including having this platform switching. But with the narrow diameter implants, because of the size of the implant, typically has to be an external connection. Also, a standard diameter implant will accept a variety of prosthetic parts and pieces, as well as allowing you to restore with either a fixed or single or full arch overdenture restoration, where typically at this time, narrow diameter implants are typically only used for overdenture stabilization. When we start looking at some of the different features of what's available with what you would see between either a standard versus a narrow diameter implant, as I open up this packaging for a Zest Anchors LODI implant, you'll see here that this does have that design profile like I just mentioned. It has this external connection, as well as a progressively shaped thread design and a very apically aggressive cutting surface. And when I compare that to an existing dental implant, and this is just showing you sort of an older model of a Zimmer-Biomet type of implant. This is an XP platform. You can see when you look at the two of those that there is a significant thread difference between the two. The one on the left is the standard diameter implant. It has a much more conservative thread, where here with the narrow diameter implant you have a much more aggressive style thread, as well as this apical tapping end. As we also look at the platform, like I just mentioned, you'll see here that you have this internal connection on the left, and on the right we have more of an external connection, and that's the case with the LODI implant. As we show you with the standard, I'm going to zoom in just a little bit more. As we zoom in with the standard diameter implant right in here, this is just showing you a 5.0 millimeter internal platform. That 5.0 millimeter internal platform can accept a variety of different connections, like this cover screw, healing abutment, as we see here, or also this specialized type of healing abutment called an encode. Additionally, when we make dental impressions, you can connect some internal impressioning components and pieces that will allow you to transfer the hex position or the internal connection portion of the dental implant. When we look at the LODI implant has many of those same characteristics of what you just saw. They allow you to have different types of abutments to go on the top, but typically the type of abutment is limited to a locator. As I place that on there, you'll see here, it screws on just like so. You can also, with the LODI implant or the locator overdenture implant, choose a different prosthetic height, which is pretty exciting, as you see here, versus this one right in here. Two different cuff heights. But also, similar to what you just saw with that existing standard diameter implant, we also have some healing abutment parts like you've seen on other clinical videos. But what you don't see is we don't have any cover screws because this implant is meant for transgingival healing or a one-stage surgical protocol. Once we get to the prosthetic part, however, once you actually connect the abutment on the top, which in the LODI case, the locator overdenture implant system, is the locator abutment. I use all my standard locator overdenture parts, and I can make transfer impressions and impression posts using all the variety of different systems to get to this analog. In many ways, the same way that you would do with a standard diameter implant. One thing to also think about when we open up the JERD article, I'll zoom back out here for a second. As we come across, you'll notice that we do have a discussion also about the prosthetic flexibility of going from either a standard diameter implant versus a narrow diameter implant. So just like what we saw here with the locator overdenture system, everything is included in the components to take you to this existing complete denture and converting it over into an implant overdenture, kind of like what you would see with this model. As we pull that apart, we know that we see here those are the locator overdenture implants in place with the prosthetic components that allow a clinician to convert a denture into an overdenture and have a very nice restoration. Whereas if we look at the fixed restorations, possibilities with the standard diameter implants are much greater. You can see here we can go from the standard diameter implant to a standard locator overdenture, like we can do with LODI, but you can also do a metal ceramic restoration, a bar overdenture, as well as a fixed hybrid type of restoration, commonly referred to as an all-on-4, or Biomet 3i calls a DM prosthesis. And what that looks like is we're pretty comfortable, and many of us in our clinical practices are used to seeing these types of models where we can show our patient the prosthetic options that are available to you. Like in this case, we're showing 2 dental implants with 2 abutments in place and a 3-unit fixed partial denture, or even just a single implant with an abutment, stock abutment, and a single crown. If we compare that, of course, to an implant overdenture, we can do that same restoration with a standard diameter implant, as we see right in here. We can also do things like with a bar or a fixed restoration. So as you see here, this is an example of an all-on-4, or also known as a DM prosthesis from Biomet 3i or Zimmer-Biomet. We can see here that this is an option that's available to patients wearing standard diameter or seeking treatment for this type of restoration is going to require a standard diameter implant at this time. Also within our implant boxes, we know that it's very similar to what you would see with the Zest locator overdenture system. This particular implant, however, only includes the cover screw. So if you wanted your analog, your abutments, or any of the impression posts or the parts that are needed for the complete denture, you will have to order those separately through your implant companies. So as we go through a little bit more of our indications as well as our recommended widths, what's important to know is that most implants require approximately a minimum of 1 to 1.5 millimeters of bone completely surrounding the implant. And that's no different versus a standard versus a narrow diameter implant. As we start looking at some of the indications as well as recommended widths in this article, we can kind of break that down a little bit further. Typically, if we were to use that 1 to 1.5 millimeter recommendation, we know that with a Zest LODI 2.4 millimeter implant, we typically recommend a minimum bone width of 5.4 millimeters. As we go up to a 2.9 millimeter diameter, it's typically 5.9. And those are the 2 diameters that we can currently order the Zest LODI implant in. The 3.25 or 4.0 are our standard diameter implants, and those are the smallest sizes that are available through Zimmer-Biomet. And you can see here that the 3.25 requires 6.4 and the 4.0 diameter requires 7.0. So that's a significant difference going from 5.4 to 7.0. And many times when patients that don't have that sufficient bone volume to accommodate a standard diameter implant, we would go with the narrow diameter implant, especially when those patients are interested in a minimally invasive procedure to help stabilize a complete denture. Versus those patients that can have standard diameter implants are those that have sufficient bone volume to accommodate either a standard or narrow diameter implant, and then also those that tend to be younger patients or those patients that might be interested in converting to a fixed restoration later at some point. Where narrow diameter implants are perfectly suited to those patients seeking a minimally invasive surgery, high bone density, especially my older patients, because the chances of them wanting a fixed restoration later are smaller, and those also individuals that just want improved denture stability. So now when we start thinking about some of these bone volumes, we can of course see that if I showed you this example of a patient, this is somebody's mandible that we used as part of a training course at UNLV School of Dental Medicine in conjunction with Dr. Andrew Engel. You can see here, this is a patient that we successfully treated with Zest LODI implants. If I were to take a measurement of this patient, we could have chosen either standard diameter implants or narrow diameter implants. As you see here, if I just do some measurements on the alveolar ridge, I have more than enough bone width to accommodate either a standard or a narrow diameter implant. So this would be an example of when a patient can be treated successfully with either type of implant, either a standard or narrow. However, many clinicians do choose to lean in the direction of a standard diameter implant here because of the prosthetic flexibility associated with and also the increased surface area. However, I've treated these patients, many patients just like this, very successfully with a narrow diameter implant, especially the LOCATOR overdenture implant. Now, when we compare that and contrast it to this case, where this is obviously just kind of a little sawbones type of maxillary arch, if I showed you, if this were a patient, and they had a bone volume width of only 5.6 millimeters here at the crest, and if I come here more to the anterior, we go down to almost 5.5 millimeters. This would be an excellent patient for this type of indication to use for narrow diameter implant stabilization, just simply because we have a smaller amount of bone width. And this patient, many times on the maxillary arch, is treated very successfully with a complete denture. And when those patients are treated successfully with a complete denture, they might seek out denture stabilization just simply because they've treated successfully with a denture, they're okay with the denture, the aesthetics, the support and everything to go along with it, but they might want to have increased stability. This would be an excellent example of where a narrow diameter implant would be more indicated than a standard diameter implant. Now, if this patient were interested in a fixed restoration, like we saw here with this DM restoration, we would need to do some augmenting type procedures or bone reduction to achieve greater bone diameter to allow us to have sufficient bone volume all the way around. So as we go through our JERD article just a little bit more, I'm going to go ahead and show you some other things that are associated with that. But this is a good reminder. We can also see in this article, here's two photos of two different patients and indications of when we would treat with either standard or narrow diameter implants. As I mentioned before, when a patient has sufficient ridge width for either standard or narrow, typically it's the clinician's discretion whether he or she would want to place a narrow or standard diameter implant. However, in the case where we have an extremely narrow ridge, like we see in this patient example right here, this is a wonderful indication of when we have not only sufficient ridge width for a narrow diameter implant, this patient was not interested in bone grafting, and there's also sufficient prosthetic height between the bone volume and the top of the denture. And how we get that is we take our complete denture, and we can then measure the intaglio surface of the complete denture. And we're typically looking for somewhere between 9 to 11 millimeters. We can do that either in the clinical chair or in our cone beam system. If we use our tissue separation technique that I love to teach about, we can see here, we see the outline of the standard complete denture. I can take a measurement from the top of the bone to the top of the denture. And when I have right around 9 to 11 millimeters, plus adequate bone volume in terms of the bone width, for a narrow diameter implant, the patient is also okay with denture stabilization and is comfortable with a complete denture, something that comes in and comes out of the mouth. It's a perfect indication for using narrow diameter implants. And now when I talk about the prosthetic measurement, what I'm going to do is take a little caliper. And this little caliper is what we would see here. You can order this just online. This is a little digital caliper, and unfortunately the batteries need to get replaced. But what you do is you take a digital caliper or a Bowley gauge and you click it here to here, and it'll give you a diameter, and a height. And this height, somewhere between 9 to 11 millimeters, is more than sufficient for overdenture stabilization. Now, do remember that number, 9 to 11 millimeters, is based upon the bone height. If you also have a range of a tissue depth of somewhere between 1 and 3 millimeters, that's where you get that range. So typically, if I'm measuring just the denture, I subtract the tissue height. So you can probe the tissue, subtract that number, add that number to the denture height, and that'll give you your proper prosthetic diameter and length. As we go through this article just a little bit more, we know that we can also do something called submerged versus one-stage healing. We also know that when I showed you before, because of our implant prosthetic options, our standard diameter implants can accept a cover screw. And as I take my little driver, we can attach a cover screw when the implant is in the mouth, and the implant can heal below the soft tissue for having submerged healing undisturbed in the mouth. A narrow diameter implant like the LOCATOR overdenture implant system, typically is always unsubmerged healing, meaning one-stage surgical protocol. Most clinicians are going to typically put this LOCATOR abutment on, and if they don't feel comfortable, or if you don't feel comfortable with immediately loading this prosthesis, soft tissue reline or provide a relief space within the complete denture. So that is a major difference between the LODI implant, narrow diameter implant system, and a standard diameter implant overdenture system. And finally, when we start flipping through the last couple pages of this article, I'm going to zoom out just to show you this really cool decision tree that I put together for this article. And this will allow you to make a decision within your clinical practice of either standard or narrow diameter implants. And now typically you begin at the top of the decision tree, and the first question you ask yourself is what is my bone width? The bone width can be measured on the CBCT or X-ray scan, or it can be made using a ridge mapping caliper in the mouth. If you have greater than 5.4 millimeters, and we know that we have prosthetic space that is somewhere between 9 to 11 millimeters, we know the bone density is high, and the patient is interested in a fixed restoration in the future, we would typically recommend a standard diameter flap or flapless unsubmerged healing. However, if the patient is not interested in a fixed restoration in the future, we can do either standard or narrow diameter implant because we have sufficient bone width and sufficient bone prosthetic space. And many times when we have low bone density right here, we typically recommend standard diameter implants because we know we have sufficient bone diameter and prosthetic space. However, because of its unsubmerged healing, narrow diameter implants with low density bone don't always perform the best. Where with a standard diameter implant, I can bury it below the soft tissue, which is a huge indication and a plus for me. Additionally, when I don't have enough prosthetic space and my bone density is high, we can see here that we're going to go and we're going to have to do some sort of alveolar reduction. And many times, if we have high bone density and the patient's interested in a fixed restoration in the future, typically we're going to bone reduce and place a standard diameter implant. When the bone density is low, we're also going to be placing a standard diameter implant with a flap and submerged healing. When the prosthetic space here needs to be created and the patient is not interested in a fixed restoration in the future, you can place either a standard or narrow diameter implant. Now, when the bone density is quite low, the bone width is lower than 5.9 or 5.4 millimeters, and is the patient interested for a fixed restoration in the future, and it's a yes, then typically we're going to have to recommend some sort of bone grafting. When the patient wants a fixed restoration, such as like a DM prosthesis or with metal ceramics, we do need to place the standard diameter implants to get a sufficient ridge width with bone grafting. Then at that point, we can then place a standard fixed restoration. If the patient is not interested in a fixed restoration in the future, then we can decide, do we have enough prosthetic space? And when we do, with high density bone, we can place narrow diameter implants. I typically place flapless, but of course we can use it with a flap as well. In low density bone, typically also what we're going to do is narrow diameter implants with a reduced osteotomy so that way I can grab the bone more. What does that mean? Typically I know that I have low or minimal bone width. The patient is okay with a complete denture, sufficient prosthetic space, but low bone density. What I tend to do with my narrow diameter implants, instead of going through the complete drilling sequence, I skip a drill and I use one less, allowing me to insert the implant through the bone with less bone prepared in the osteotomy, so that way the aggressive nature of this implant, of this LODI implant, can grab the bone as it's being inserted. It's a very nice feature of the LODI implant. When we know that we don't have enough prosthetic space, typically we do need to have alveolar reduction, and if the bone density is high, we can have the implants placed with unsubmerged healing, but when the bone density is low, we're going to go ahead and do a flap, reduced osteotomy, unsubmerged healing, which is still a requirement of the one-piece LODI, or the two-piece one-stage LODI implant. And the big difference between the two of these right here is just about how you do with your reduced osteotomy. So in low bone density situations, wherever we are, typically recommend reduced osteotomies so that way you can increase your primary stability. Because bone density really is a critical factor, as I describe here later in this article, and many times bone density is a critical factor for me for implant success later on, whether it's standard or narrow diameter implants. I'm going to zoom out just a little bit. Here at the end of the article is my entire reference review. As you can see here, I get kind of carried away when it comes to reviewing the literature. I really like to make sure I have a very, very nice review of everything that is possible out there, so feel free to read over those references, read into some of the other materials that you like. At the end of this special edition Jerd release, you're going to see here that we also have a nice clinical case demonstration that I did with Dr. Andrew Engel at the UNLV School of Dental Medicine. This is a nice case that we did as part of one of our training programs there at the university where we train clinicians. You see, we took a standard complete denture patient that was interested in denture stabilization. We did a soft tissue separation technique, making a cone beam scan, and on that cone beam scan it allows us to plan the implants in positions that we think is best in terms of relation to the denture prosthetics as well as the bone volumes. Once that's been done, we know that we've got these green lines showing up on our CBCT scan on the in vivo software. We can then take a duplicate of this patient's denture and then punch 4 holes in line with this cone beam scan on a drill press. Very, very simple. And we can see here we can take that to the mouth and then do our initial pilot holes through that drill press guide, and then finishing our osteotomy and implant preparation, as well as deliver our abutments, connect it to the denture the same day with a high degree of precision as well as long-term success. So this is Dr. Michael Shear with Learn LODI. I certainly hope that you've enjoyed this YouTube video on the topic of the Journal of Implant and Reconstructive Dentistry special release article that I prepared for you. This is available through Zimmer-Biomet, also through the journal's website, and Zest Anchors has it available on their website. I will also provide a link in the comments section or in the description section of this YouTube video, so that way you can reference this on your own. Again, it's a pleasure. Dr. Michael Shear with Learn LODI, a free resource on how to market, treatment plan, place, and maintain locator overdenture implants. Stay tuned for future videos. Bye-bye.